Munson. Yes, ma'am. Is it true that the House and Senate health care reform bills explicitly exclude illegal immigrants from receiving government-funded health care? Dana, it is true, I believe, from what I know of the bills, that illegal immigrants are not covered under the bills. However, it's also true that we have a fundamental enforcement problem with everything to do with illegal immigrants. So the question is, how is this enforcement, how is this issue going to be any different? And I believe that, in fact, under those sorts of plans with the government option, we would spend a lot more money on health care for illegals. But it is true that the bills do not cover them directly. It's also true that when proponents of the bill talk about the uninsured problem, they say it's a 45, 47 million person problem. But of that number, a quarter of that number, a full quarter of that number are illegal immigrants. Now to me, that part of the problem, it's a problem, but to me that part of the problem is a law enforcement problem, not a health insurance problem.
Exactly.
So do you have a follow-up?
Yes, I do. So based on your answer, it would be safe to say that this healthcare reform would affect uninsured Americans and not uninsured illegal immigrants, right?
Well, you're right in the sense that the bills don't purport to cover illegals. I believe as a practical matter, they would result in our spending even more money on health care for illegals.
But as far as the bill is written, it's for uninsured Americans.
Yeah, but I'm also concerned about the real world and how it is put into effect.